Right before I gave birth to my son, Teddy, my husband and I went to the doctor for a checkup, and I took the opportunity to ask my doctor if everyone who will treat me at the hospital will be covered by my insurance. I saw a nightly news package about surprise medical billing, and I wanted to be safe. My doctor said she didn't know and that it was totally normal to get a surprise bill. I got all sorts of bills after I gave birth, she said with a chuckle. I didn't understand what they were. You just pay and you move on. What? My husband and I were shocked. Did my doctor really just say that? Were we the crazy ones for thinking that that was completely crazy? No, we weren't, because it is crazy. And now some lawmakers are trying to do something about it. But one powerful dark money group is spending a lot of money to stop it. Joining me now, two lawmakers on opposite sides of the aisle who are behind the No Surprises Act in the House: New Jersey Democratic Congressman Frank Pallone and Oregon Republican Congressman Greg Walden. Gentlemen, thank you so much for being here. Thank you so much for working together on some legislation that would help genuinely affect people's lives. Congressman Pallone, please just explain what it is.
Well, what's happening now is a person will go, for example, to an emergency room. And, for example, the anesthesiologist or someone else is not in their network, and so they get a bill that could be for $1,000, $10,000, who knows, after, because it's not covered by their insurance. And we want to put an end to it. I mean, it's just ridiculous. This should not be something that the patient has to worry about. You know, the insurance companies should deal with it and not the patients. A
lot of money is being spent, Congressman Walden, on trying to stop this legislation. Doctor-patient unity, a dark money group, has spent $13 million. I say dark money because we don't know who's behind that group. Why do you believe they're trying to stop this legislation from going through?
You know, it's what some of these groups do. It also tells me there's an enormous revenue stream behind it, and it's the consumer that's getting stuck. And your situation is just like we heard from Sonja Wilkes, who testified before the committee. Her son, when born, had a medical issue. They rushed him into the neonatal intensive care unit 50 feet down or whatever from where she delivered the son, and they got a bill for 50 grand because while the hospital was in network, guess what? They'd contracted out their neonatal intensive care unit. She had no idea that had happened, nor should she have to. And so these guys are making a lot of money off the backs of patients who are playing by the rules to the best of their ability, and we're going to put a stop to it.
So there are healthcare provider and hospital groups, according to Bloomberg, that are pushing back on this as well. They're saying that this is a rate-setting approach. They're claiming it unfairly favors insurers, and they warn it could discourage doctors from practicing in certain areas where the rates would be lowest. These groups have also spent heavily to influence bills this year.
Well, Katie, if I could say, what we're seeing basically are these Wall Street firms, if you will, that are buying physician practices and then placing physicians in the emergency room, for example. So they're basically, reaping the profits. It's not even the physicians. It's these, they call them venture capitalists or private equity groups. I call them Wall Street firms that basically have bought these physician practices. And they're the ones that are running these ads. In fact, we didn't know exactly who they were, but the New York Times today just started to run a story that actually named some of them. And these are these Wall Street, venture capitalist firms, essentially, that have bought the physician practices.
Congressman Walden?
And Kay, we have evidence, and we're sending them a letter. I think Frank and I both are. We have evidence where they buy the practice, take the physicians out of network, raise the rates by 96%. And guess who's paying that? It's people like you and me and our constituents. And then they decide whether they get back into network. So this is an enormous scam. It's an enormous money drain on consumers. We want to be fair about the result. We want to hold harmless the consumer. We're open to having policy discussions about the best way to do that. I think we have a good compromised bill that's passed out of our committee unanimously. But, if they think they're going to intimidate us by $27 million, by the way, in advertising attack ads that scare people falsely, they're making a big mistake.
So does this have a chance?
Katie, I just wanted to mention, too, this is both Democrats and Republicans in the House and the Senate and President Trump who say they want to get rid, who are supportive of this. So these Wall Street firms are against all of us. This is not partisan. The president even says he supports our legislation.
Well, that was going to be my question. So there's legislation that mirrors this in the Senate. As you said, the president favors this. Does this mean that this legislation will pass?
I think it has a very good chance of passage for those reasons, and it's an indication, which I like to say often, that oftentimes, both parties agree and even agree with the president, and it's oftentimes, in this case, these Wall Street firms or other industries that, try to prevent when we're trying to help the consumers.
Any timeline?
And Kate, I would say that the chairman had every one of these entities before the committee, and they all pledged to us they were with us in making sure the consumer was held harmless in this. Well, they need to make good on their pledge.
Again, I thought it was completely nuts that my doctor was like, "Yeah, you just deal with it and you pay it." Nuts.
Well, you're absolutely right.
That's
and
outrageous.
We're hoping we can get this done this fall, certainly.
Congressman Frank Pallone and Congressman Greg Walden. Gentlemen, thank you so much for coming on together. We do appreciate it.